What's the worst thing you've seen as a doctor? My name's Dr. Ash Bowden, and I've been in Australia for just over 6 years now, working mostly in emergency. This is case number 2, the case of conscious CPR. Working in an emergency department, mentoring a medical student who was with me when the crash call went off. When you attend a crash call, most of the time it's a false alarm. A patient has pressed the wrong button, or we don't need to do anything too urgently. This wasn't the case. As we turned the corner to the triage area, there was a nurse that had already started CPR on a patient in a chair. I immediately went over and froze. It's frustrating, but sometimes I feel like a rush of information and I actually don't know exactly what to do immediately. There was no one else around other than paramedics waiting to offload their patients. Some of them came over to help. I tried to put a cannula in the patient's vein and failed to do so. The paramedics that were in attendance were incredible, and as we later talked about, this is their bread and butter. We managed to get the pads on and we were doing CPR. We were right next to resus and no one was coming out of the doors. I kept on asking whether people could notify the doctors that were in there. A bit of a system failure. For some reason, that crash alarm wasn't going off in the resus bay. Someone brought a bed round, we transferred the patient who was receiving CPR and wheeled them through to resus to some very surprised doctors. And this is where it gets weird. As I was doing CPR, the patient became conscious. He tried to fight me off of him, so I stopped. As soon as I stopped, the patient went floppy and essentially died again. No pulse. I immediately resumed CPR. I was looking up at my senior doctor asking what should I do, who had just learnt about this whole situation, looked very conflicted and essentially was telling me to stop CPR. Meanwhile, an intensive care paramedic was saying, no, continue, this means you're doing a good job. I had this weird conflicting feeling, should I be doing CPR? And every time I resumed CPR, this patient would come up and try and fight me off. But as soon as I stopped, he went floppy and had no pulse. This is what I've later learned is CPR-induced consciousness. The great thing about this case is we eventually got what's called ROSC, Return of Spontaneous Circulation. The patient was transferred to the nearby hospital, and I even got a message from his daughter saying that he was alive and well, which rarely happens. But this haunted me. For the next few days, I kept on seeing this man's face looking scared and trying to fight me. I think what didn't help is I didn't know what the right thing to be doing. As I've later learned, this is a bit of an unusual situation. A lot of physicians disagree with how you should manage CPR-induced consciousness. The thing that stands out most about that day is when I was telling my partner's family about it, her dad asked me, how are you going to be okay? And that was such a poignant question, something I later discussed with a psychologist. And through talking about it, thank you, I feel like I'm doing all right.